about a topic that we have discussed several times before. But because of the messages that we'll be getting from people that they want us, although the video is there, I just don't know why you guys can't just go there and watch it. But they keep asking me to make a video on diabetics. So I'm going to be talking about diabetics. And do not forget, if you're living in Metro Atlanta area, you find it difficult to get a transportation to go for your doctor appointment, Gateway 101 would help you. It's a free ride to your doctor appointment at no cost. This is our little way of saying thank you to the community that we live. It's also our little way of contributing to the community that we live. Okay, so do not forget to always contact us in Gateway 101. We also create healthcare awareness. And do not forget that in Gateway 101, we do not diagnose or prescribe treatment. Okay? All we do here is to create healthcare awareness. While whatever we say here does not constitute diagnosis, it is a healthcare awareness. We are promoting healthcare awareness. That's why we keep telling you to go for your medical checkup. Okay? Because prevention is always better than cure. And also do not forget, we have a lot of simple home remedy that will help elevate illnesses, elevate symptoms. Okay, we also give you prevention tips. Okay, so do not forget, we are creating healthcare awareness. So in today's live broadcast, we're going to be talking extensively about diabetes. Okay, so without wasting much time, let's dive into it. Diabetes is a long-term chronic, chronic, long-term chronic condition that affects how your body controls blood sugar, glucose, which is the main source of energy for your cell. Normally, your body uses a hormone called insulin made by the pancreas to move glucose from the blood into cell. Diabetes happens when insulin does not work properly. So is not made in enough quantity, causing blood sugar level to become too high. We'll be talking about type of diabetes and their causes. Type 1 diabetes. What happened? The immune system mistakenly attacked the insulin-producing cell in type 1 diabetes. So the insulin-producing cell in the pancreas is mistakenly attacked by the immune system. So this causes autoimmune reaction, not caused by diabetic type 1 is not caused by your lifestyle. So this result in little or no insulin is produced. Common age often started in childhood or younger adulthood. Once you are diagnosed with type 1 diabetes, you have to be on lifelong insulin therapy. In other words, you will take insulin therapy during your lifetime if you're type 1 diabetics. While in type 2 diabetes, which is most common, what happens is that the body becomes resistant to insulin, or the pancreas does not make enough insulin. Okay, so overweight or obesity can play a major cause of type 2 diabetes. Physical inactivity. If you are not doing physical therapies, physical activity, you don't go to gym, you don't exercise, can be a major contributing factor to type 2 diabetes. Unhealthy diet, mostly if you are eating high sugar food, sugary juice, refined carbs, can play a major contributing factor in type 2 diabetics. Okay, family history, it can be genetics, that is, it is hereditary. Your grandparents might have it, your parents have it, or your grandfather have it, and now it's not passed over to you. So it can be heredity. Type 2 diabetics. Aging can also be a contributing factor for type 2 diabetes, usually adult, but now increasingly seen in younger people. Okay, can often be managed. Yes, diabetes type 2 can often be managed with lifestyle changes. Like I said, you stay away from sugary food, processed carb, and sugary juice. Oral medication can also be used to help manage it, and sometimes insulin can also be used to manage type 2 diabetics. Okay, and gestational diabetics. If you're talking about gestational diabetes, what happens is that um, high blood sugar develop during pregnancy. So the causes will be pregnancy hormone interfere with insulin function. So that's what causes gestational diabetes. So the risk factor is being overweight can be a contributing factor. Family history of diabetes can also be a contributing factor for gestational diabetes. Previous gestational diabetes can also be a contributing factor. Usually goes away after childbirth. In other words, yeah, gestational diabetes should go away, should be resolved. It should resolve on its own after childbirth, but it increases future risks of type 2 diabetes. So take note of that. Other less common causes of diabetes will be genetic disorder affecting insulin production. The disease of the pancreas can also be a contributing factor or causes of type 2 diabetes. Certain medication and long-term steroid use can also contribute to diabetes. Hormonal disorder can also be a contributing factor for diabetes. So why diabetes is serious? If not controlled, diabetes can damage your heart and blood vessels. So take notice of that. If your diabetes is not controlled, it can damage your heart and also your blood vessel. It can also damage your kidney if diabetes is not controlled. It can also damage your eye. It can cause you blindness if diabetes is not controlled. Nervous, leading to numbness or pain. Okay? And feet, you have a slow healing and infection if your diabetes is not properly controlled. So common symptom of diabetes will be frequent urination. These are some of the common symptoms of diabetes. Excessive taste is another symptom of diabetes. You drink water and you feel like drinking again, urinate very often. Extreme hunger, you eat but you continue to crave for more food. Fatigue, even though you have rested, you feel tired. Okay, bland vision is a common symptom of diabetes. Slow healing wound is a major symptom. It's a very common symptom of diabetes. In other words, you suffer an injury, but it's taking long. Okay, taking longer for the wound to heal. These are common symptoms of diabetes. Okay, so we're going to be looking about diabetes overview and management of diabetes. So let's take a look at that. Let's take a look at management of diabetes. Remember what we said, that diabetes is a long-term chronic condition that affects how your body control blood sugar, which is glucose. Glucose is the main source of energy of your body and comes from the food you eat. A hormone called insulin helps move glucose from the blood into the cell. In diabetics, this process does not work properly. Okay, we just talk about type of diabetes. I will say type 1 diabetes, the body does not produce insulin, usually started in childhood or young adult. People need insulin injection for life if you are type 1 diabetes. Why is type 2 diabetes, which is the most common, the body does not use insulin properly or does not make enough. so often lead to overweight, unhealthy diet, and lack of exercise can sometimes be prevented or delayed. Then we also talk about gestational diabetes, and we said that this occurs during pregnancy, usually goes away after delivery, but increase the risk of type 2 diabetes later in life. We also talk about the common symptom of diabetes. I would say that frequent urination, excessive taste, increased hunger, fatigue, tiredness, blunt vision, slow healing of wound. Some people, especially with type 2 diabetes, may not have the symptom at first. So how can diabetes be managed? This will be our main focus tonight. How can diabetes be managed? Although diabetes has no permanent cure, it can be effectively managed with proper care. Healthy eating. Eat balanced meal with vegetable, whole grain, lean protein, and healthy fat. Reduce your sugar intake, reduce your sugary drink, and refined carbohydrate. Also, control portion size and eat at regular time. Engage in regular physical activities. Okay, aim for at least 30 minutes of exercise, like walking most days. Exercise help lower blood sugar and improve insulin use. So engage in physical activity. You exercising 3 times a day, a week, three times a week, 115 minutes of regular exercise. Even if you are doing even a light exercise, but just engage in some kind of physical activity. This would help reduce. This would help limit the risks of getting diabetes. Exercise help lower your blood sugar and improve the insulin use. So engage in physical activity. Diabetes can also be managed by medication or insulin. Some people need oral medication. Others, especially type 1 diabetes, need insulin injection. Always take medication as prescribed by a doctor. So blood sugar monitoring. Check your blood sugar level regularly to ensure they stay within a healthy range. And also manage your weight. Okay, losing even a small amount of weight can greatly improve blood sugar control in type 2 diabetics. Regular medical checkup. This is our emphasis. Do not forget that Get Well 101 will places much emphasis on regular medical checkup. That's why we provide free transport for those going for their doctor's appointment who cannot afford transport. We provide that for free. It's our little contribution to the community that we live, because we place much emphasis on healthcare awareness. So regular medical checkup is very important. Is very important. So eye exams, kidney tests, food care, and blood pressure monitoring help prevent complication. Okay, why is management important? Why is diabetes management important? Because poorly controlled diabetes can lead to serious problems like heart disease and stroke, kidney failure, vision loss, nerve damage, foot ulcer, and amputation. Okay, so let's look at diabetes management and diet. Let's look at diabetes management and diet. So let's look about that. Okay, it is okay. So lifestyle management of diabetes. Diabetes management is about keeping blood sugar within a healthy range every day. So this involves food, this involves activities, this involves medication and habit. A daily routine basic, eat at regular time, don't skip meal, monitor blood sugar if advised by your doctor, take medication on insulin as prescribed, stay active even Even light movement helps. Remember, we talk about physical activities, engage in physical kind of exercise. 30 minutes a day, 3 times a week, 150 minutes a week would be of great benefit for you because that helps insulin work better. Also, if you're on medication, make sure you take your medication. Okay? If you're on medication, take your medication. And do not forget to monitor. Don't forget to monitor your blood sugar regularly if advised by your doctor. If you're on medication, do not skip your medication. Okay, as prescribed, stay active and sleep well. At least have 7 to 9 hours of sleep daily will help manage stress because stress raises your blood sugar. Okay, so manage stress because stress raises up your blood sugar. Diet principle, diet principle for diabetics. If you're diabetes, you don't need special food, just balanced meal. Okay, the plate method and is effective. Okay, so eat non-starchy vegetable. Okay, such as your spinach, your cabbage, broccoli, carrot, tomato, lean protein. Eat fish, eggs, chicken, healthy carbohydrate. Okay, a small amount of healthy fat like your olive oil, avocado, nuts should be added to your food. Food to eat more often if you're a diabetes patient. Best choice will be for carbohydrates. Uh, choose whole slow digesting food like brown rice, oatmeal, whole wheat bread, sweet potato, beans, and lean protein. For protein, eat fish, chicken without skin. If you're diabetes, eat eggs, also good for your source of protein. Beans, soya beans, also good for your source of protein. So vegetable, very important if you're a diabetic patient. Green leaves is very important. Cabbage is very important. Okra, green beans are also very important for a diabetic patient. Tomato, onions, pepper are also very important for diabetes patient. Fruit in moderation. Eat apple, berries, your orange. In moderation, also good for diabetic patient. While for fat, eat small amount, or you can have olive oil, nuts, seed, and your avocado are also very good for a diabetes patient. So food to limit or to avoid if you are a diabetes patient. So you should avoid this food or limit the intake of the following food I'm going to be mentioning. Sugary food and sugary drink should be limited or avoided completely if you are a diabetes patient. Soda, fruit juice, candy, cakes should be limited or avoided completely if you're a diabetic patient. Refined carbs, you should also avoid refined carbs such as white bread, white rice, pastries. If you're a diabetic patient, avoid the intake of white bread and white rice because these foods are full of high carbohydrates, carbs. So you can limit the intake of these foods or just avoid it completely. Limit intake of fried or fatty food if you're a diabetic patient. Okay, deep fried snacks, eat fast food. Your eating of fast food should be greatly limited if you're a diabetes patient. Okay, eating a large portion of food if you're a diabetes patient should be avoided. Even a healthy food can raise sugar if eaten too much. So your portion should be a small portion or moderate if you're a diabetes patient. Okay, so for simple daily diet plan for a diabetes patient would be for your breakfast, you want to take oatmeal with nuts or some boiled egg, whole wheat bread plus egg plus vegetable. This should be your breakfast. While snacks option would be fruits like apple or orange. Then or a handful of nuts should be your snacks. Then during lunch, For a diabetic patient, you may want to eat brown rice or sweet potato, grilled fish or beans, large serving of vegetables. If you're a diabetic patient, that should be your lunch. Then your snacks should be yogurt or sweetened or carrot or cucumber slices should be your snack for dinner and for lunch. While your dinner should be a small portion of carbs, protein such as fish, chicken, beans, plenty of veggies. If you are a diabetic patient, it should be your dinner. So drink water or sweetened tea. Avoid sugary drink if you are a diabetic patient. Then physical activity, very important for a diabetic patient. 30 minutes most day, walking, dancing, cycling, housework, okay? Even 10 minutes after meal help lower blood sugar. So other daily tip will be shake your feet daily. If you're a diabetic patient, make sure you shake your feet daily. Very, very important. If you're having a wound that is not healing properly, please seek a medical help immediately so that your leg will not be amputated at the tail end of it. Because if you have a complication, your leg might be actually the foot, you might actually have a gangrene without you knowing. Okay? And before you know it has spread because you don't have much feeling, much sensation in your foot. So if you're a diabetic patient, make sure you shake your foot daily. It's a must. Okay? Diabetes can affect circulation. I have seen somebody who have a very small wound in his foot. He actually thought that the wound has healed, not knowing that the wound has not healed, even though the surface look as if it is healed, but beneath it, it's actually had gangrene, and it has spread. So the only time they notice that this thing has spread is when the toenail begin to turn dark and hard. So they took him to the hospital, although they found out that the leg needs to be amputated below the knee. So if you're a diabetic patient, this is what thing you must do daily. Do not forget to shake your feet. It is very, very important to prevent complication. Because at the end of the day, the doctor will left with no choice but to cut to amputate the leg. So his leg was amputated, and you know what that means. So, and it took he was so depressed and he was no longer himself. Okay, after that surgery, he was no longer himself. Okay, it take a toll on him. So if you're a diabetic patient, I beg you, make sure you shake your foot daily. Actually, shake it as often as possible daily. Let me put it that way. Shake your foot as often as possible daily. Okay, so and also if you're a diabetic patient, please don't smoke. Okay, these are some daily tips that really complicate your health. So you should don't smoke, leave cigarette alone, and limit your alcohol intake. If it's possible, avoid taking alcohol. Okay, and keep regular doctor checkup. You cannot overemphasize. You cannot overemphasize that. Make sure you keep your regular doctor checkup. Very important. So the key takeaway here is this: diabetes can well be controlled. It can well be managed. Okay, diabetes can be well controlled with smart food choice. It can well be managed with regular activities. Diabetes can well be controlled with consistent medication. It can also well be controlled with healthy daily habit. Okay, so let's look about some diabetes management tips. Let's look at some diabetes management tips because we're talking extensively on diabetes today. So please take note of what we are saying here. Why this does not constitute medical diagnosis, we place much emphasis on healthcare awareness. Okay, so we'll talk about eat smart, not less. So you don't need to starve yourself. You need a balanced meal. So focus on whole grain, brown rice, oatmeal, whole wheat bread, lean protein such as fish, chicken, beans, and egg. Plenty of vegetable. Plenty of veggie cannot be overemphasized. Eat especially green leaf and healthy fat such as your avocado, your olive oil, your nuts. And we also said that you should limit your sugary drink and snacks. We also said limit or avoid eating a white bread, pastries, and processed food. Large portion also say you should avoid eating large portion of starchy food, such as your rice, yam, and pasta. You also advise you to use the plate method, okay, to eat at regular time. Skipping meal can cause blood sugar swing. So eat your meal at a regular time and try to eat meal with snacks at the same time daily. If you are a diabetes patient, try to eat meal and snacks at the same time daily. And don't skip your breakfast. If you're a diabetes patient, don't skip your breakfast. Stay physically active if you are a diabetes patient. Exercise help lower blood sugar naturally. Exercise help lower blood sugar naturally. So aim for 30 minutes of walking, cycling, or swimming most day. Light strength training, like 3 to 4 times per week. Even household can't. Movement matters. Okay, so monitor your blood sugar. If you're a diabetic patient, will encourage you to check as recommended by your healthcare provider. Make sure you monitor your blood sugar. What you need is your AccuCheck machine. AccuCheck machine is the device they use to check your blood sugar. So make sure you have that with you if you are pre-diabetics or you are a diabetic patient. Once you are diagnosed with diabetes, you must have that AccuCheck machine at home. Also, make sure you check your blood sugar daily if you are a diabetes patient. This is very, very important. This will help prevent complication. Okay, so keep a simple log of reading. So meal and activity, keep a simple log and keep your reading because your doctor needs that log to help manage your blood sugar. Okay, so write down your blood sugars every time you check it, and do not forget to take it with you to your doctor appointment because your doctor needs that to help manage your blood sugar. Learn what food or habits raises or lower your blood sugar. You should be able to tell what food raises up your blood sugar or what food lower your blood sugar. And also, if you are on medication, if you are prescribed medication, do not forget to take your insulin or your oral medication on time if you take medication as prescribed. Okay, never stop or change dose without medical advice. Okay, set phone reminder if needed. Okay, prioritize sleeping and manage stress if you're a diabetic patient because stress raises up your sugar level. So aim for 7 to 9 hours of sleep daily and practice stress relief techniques. Okay, so deep breathing, prayer, meditation, or light stretching. This will help relieve stress. So chronic stress can raise your blood sugar. Okay, so try to stay stress free and also stay hydrated. Drink plenty of water. Very important. Avoid soda, sweet juice, or energy drinks if you're a diabetic patient. And also avoid smoking and limit alcohol intake. Actually, avoid smoking and alcohol if you're a diabetic patient because this is of no good for your health. Because smoking increases diabetes complication. Okay, so if you're a diabetic patient, completely avoid smoking and alcohol because it will increase your diabetes complication. Alcohol can cause dangerous blood sugar drop. Okay, so drink only if approved by your doctor. But The good news is actually, my advice is, why do you want to actually drink alcohol if you're a diabetic patient? Knowing fully well that alcohol can dangerously drop your blood sugar level. So avoid alcohol if you're a diabetic patient. And take care of your body. If you're a diabetic patient, check your feet daily. We cannot overemphasize that. And check your feet daily for cut or sore. Also maintain good oral hygiene. Get regular checkup. Check your eye, your kidney, your blood pressure. Okay? Your A1C, very important. And stay consistent, not perfect, but stay consistent. Diabetes management is about daily habit, not perfection. Okay, small consistent choice lead to a big health improvement over time. Okay, so yeah, we have dealt excessively with diabetes management tips. So look at diabetes and its management. Let's look at diabetes and its management. Okay, so like I said, today we're talking about diabetes. Okay, so um, diabetes, like as I've said, is a long-term chronic condition that happens when the body cannot properly regulate blood sugar, which is also known as glucose. So glucose is the main source of energy for the body, and insulin, a hormone made by the pancreas, help move glucose from the blood into the cell. So in diabetics, insulin is neither produced enough or does not work effectively. So this causing a high blood sugar level. We also talk about type of diabetes. I would say that type 1 diabetes, the body produces little or no insulin at all. I will also say that usually develop in children or young adult. And we also say that once you are diagnosed of type 1 diabetes, you require insulin intake for life. You require daily insulin injection. Okay? While type 2 diabetes, which is the most common, the body does not use insulin properly. Insulin resistance often lead to overweight, poor diet, or lack of physical activity. Type, type 2 diabetes cannot be cured, but it can be managed. Okay? Can be managed with lifestyle changes or oral medication and sometimes insulin. So gestational diabetes occur during pregnancy. Gestational diabetes usually disappear after childbirth, but increasing the risk of type 2 diabetes later in life. So pay attention if you have gestational diabetes. Okay? I will also say that the common symptom of diabetes will be frequent urination, excessive taste and hunger, fatigue, blurry vision, slow healing wound, unexplained weight loss, especially in type 1. We also talk about how diabetes can be managed. And we said healthy eating, choose whole grain, eat a lot of veggies, a lot of fruits, and lean protein. We also said that you should limit your sugar, refined carb, and processed food. If you are diabetes, eat at a regular time to control your blood sugar level. Okay. We also said that if you're a diabetes patient, regular physical activity will be of great benefit in managing your diabetes. Aim for 30 minutes of exercise most day, walking, cycling, swimming. Exercise help the body use insulin better. We also said that blood sugar monitoring, so regular check blood glucose level as advised by a healthcare provider. This help understand how food, exercise, and medicines affect blood sugar level. Medication and insulin. Type 2 diabetes may require oral medication. Type 1 diabetes usually require insulin for life. So some type 2 diabetes may also need insulin over time. So it depends on the complication on how your provider want to manage your diabetes. So weight management, losing even 5 to 10% of your body weight can significantly improve your blood sugar control. So if you're obese, try to manage your weight. Just losing 5 to 10% of your body weight can significantly improve your blood sugar control, and also stress management and sleep. Stress raises your blood sugar level. Okay, so aim for 7 to 9 hours of quality sleep each night. Okay, because stress do raises up your blood sugar level. So make sure you have proper sleep. Sleep at least 7 to 9 hours of quality sleep each day. Regular regular medical checkup. This we cannot overemphasize. Monitor your blood pressure, cholesterol, eye, eye health, kidney function, and feet to prevent complication. Can diabetes be prevented? Type 1 diabetes cannot be prevented. Type 2 diabetes can often be prevented or delayed through healthy eating, regular exercise, and maintaining a healthy weight. Once again, can diabetes be prevented? Type 1 diabetes cannot be prevented, but type 2 diabetes can be prevented or delayed through healthy eating, regular exercise, and maintaining a healthy weight. So, the key takeaway here will be diabetes is manageable with the right lifestyle choice, such as medication and regular monitoring. People with diabetes can live healthy, active, and long life. Okay? So remember what we said, that why this does not constitute medical diagnosis. This is Gateway 101. So we're going to recap again. Okay? We will recap again. We'll do that so that people can better understand what we are talking about. So let's recap. Let's recap again. So we started by saying that diabetes is a long-term chronic condition that affects how your body controls blood sugar. Also said that glucose, which is the main source of energy for your cell. Normally, your body uses a hormone called insulin made by the pancreas to move glucose from the blood into the cell. So diabetes happens when the insulin does not work properly or is not made in enough quantity. We also said that causing blood sugar level to become too high. And we said that type 1 diabetes, the immune system mistakenly attack the insulin producing cell in the pancreas. So it causes autoimmune reaction, not caused by lifestyle. Type 1 diabetes is not caused by a lifestyle, but it resulted in little or low insulin production when the immune system mistakenly attack the insulin producing cell in the pancreas. So it resulted in no insulin produced. And also, the common it often started in childhood or younger adult, and it required lifetime insulin for therapy. Lifelong insulin therapy. Okay, why we say that? So what happened in type 2 diabetes? Type 2 diabetes is the most common diabetes. The body becomes resistant to insulin, or the pancreas does not make enough insulin in type 2 diabetes. Overweight or obesity, physical inactivity. The causes of type 2 diabetes is one, overweight or obesity will play a major role. Physical inactivity, unhealthy diet, high sugars, refined carb, family history, genetic, that is, it can be hereditary, and also age. Usually adult, but now increasingly seen in younger adult. Okay, so it can often be managed. Type 2 diabetes can often be managed with lifestyle changes, oral medication, and sometimes insulin. Okay, we also talk about gestational diabetes. I will say that gestational diabetes, what happens is high blood sugar developed during pregnancy. Okay, cause will be pregnancy hormone interfere with the insulin function, and the risk factor will be being overweight, family history of diabetes, previous gestational diabetes. Usually goes away after childbirth, but increases the risk of future diabetes. of visual type 2 diabetics. So other common less cause of diabetes will be genetic disorder affecting the insulin production, and disease of the pancreas, and certain medications such as long-term use of steroid can also lead to diabetes. Hormonal disorder can also cause diabetes. So diabetes is serious if not controlled. Diabetes can damage your kidney, can damage your heart, it can damage your blood vessels. It can actually cause you blindness if it is not properly managed. Okay, so it is serious. And now it can cause you nerve damage leading to numbness or pain. Remember the issue of the man with amputated leg? Because the feet become numb, so he was not having pain or feeling anything on his feet. So he thought that the wound he had in his foot has healed, but not knowing that the wound, the surface look healed, but beneath is gangrene. So this thing was eating up his foot gradually. But before they discover it, it has turned gangrene. They have to amputate the young man's leg. So we strongly recommend that you check your feet daily if you're a diabetic patient, because your wound will not be healing properly. If you have a wound, make sure you seek proper medical attention. So common symptoms will be frequent urination, excessive taste, extreme hunger, unexplained weight loss, fatigue, blurred vision, and slow healing. Okay, so why this does not constitute medical diagnosis, as we usually say in that Gateway 101, this is healthcare awareness. So if you're having any of these symptoms, common and frequent urination, excessive taste, extreme hunger, unexplained weight loss, fatigue, broad vision, slow wound healing, if you're having one or all of these symptoms, please go and seek medical help, okay? Because this does not constitute medical diagnosis, but this is a healthcare awareness. And that's what we're doing at 101. We create healthcare awareness because we strongly believe that prevention is better than cure. So go seek medical help so that you can be properly treated, okay? Until I come your way again, this is Gateway 101, and thank you so much for watching. Stay blessed and see you tomorrow. Thank you.